They're just waiting on the conversation to start.
So, Janine, are you going to count the water?
Oh my goodness. You have, I think you just send the information. I'm curious to know more about it. Of course, I have my regular job, but if it's something, I just want to.
No, that will be a one.
Yeah. And I have another one. But
So, like, you, I understand the language change, but this is your thinking now.
what is that? Channel y'all want to share the live stream? Diminishing. Meaning that your ability to volunteer is diminishing. That life is that you're not able to
Taking advantage of
Am I in this video? Hey y'all.
All right, you take care. I'll talk to you soon.
All right, everybody, I am back. I know you guys are having some very, very rich conversations. Look at my daddy, he's still talking to us. Hello again, everybody. Like I said before, my name is Julian Green, and I'm the Community Engagement Manager with YWCA Central Carolinas. I'm so happy to see so much of my YWCA crew here. The philanthropy team is here. We have even Adrian's here. She's with fitness, front desk, all that. So we just have amazing people here. Finance is here, Julian here, and of course our lovely board members who I have to make sure I shout out. Lisa's here. And Ashley's here, and a very special shout out to Ashley specifically. Ashley was amazing piece of all of this puzzle of this whole conversation that we're having. If you do not follow Ashley on social media and all of her work, she's the dementia guru, and she is truly a guru in just connecting people as well. Just an amazing force. So I would love everybody to give Ashley a round of applause. You see her, she has that cute bun on her head. She's right there. But she's just been amazing. Just an amazing force when it comes to just pulling the information together, making sure that I'm asking the correct questions. So I really appreciate her for that. Also, want to thank Google Fiber, who's one of our sponsors as well. We appreciate them. As well as the League of Women Voters. They are some of my favorite folks, especially during this season. Reagan's over there hanging out. Reagan has done a ton of stuff with us, and Kevin, he just actually popped out. But they've been instrumental with all of our work around Get Out and Vote, and we'll continue to work with them in the fall as well. So excited about that. If you want to stop by the table, you can. If you want to make sure you're registered, check your status of your registration or anything like that, they are able to help you and guide you there. So thank you so much again to the League for being present here. Just a couple of housekeeping things too. We are in a space. First off, thank you, Caldwell Presbyterian Church. They are, Peggy's not here, but we appreciate them for allowing us to use this space. They are a green space. They're trying to take on more green initiatives when it comes to their waste. And so you'll notice that you guys are eating on compostable plates and using compostable napkins so we can actually throw those away. Now your bottles, please leave your empty water bottles on the table. We will collect them at the end so that we can recycle them, okay? So thank y'all for that. As well as if you want to leave your slip of paper on the table, you can leave it there as well, and we will dispose of that also, okay? Okay, so now we got all that out of the way, right? So now I would love to introduce our amazing panelists that I've had the blessing and the privilege of being in contact with over the past few weeks. I was able to have many conversations with them before they even met. Well, I feel like some of y'all have known each other for a while, but I was able to meet with all of them separately over the past few weeks. And when I say these people are doing amazing work around caregiving and advocacy associated with it, but also programming associated, it blows my mind, and research associated with it as well. It blows my mind. And so I'm gonna read their bios quickly, okay? So we have Miss Juanita Brooks Wade here. This lovely dress on. Public service is a mainstay in Juanita's life. She currently volunteers at the Alzheimer's community as an Alzheimer's community educator and support group facilitator for the Alzheimer's Association of Western Carolina. This work follows her public service in Boston and DC as elected public official, voter rights registration advocate, and human rights advocate. Juanita's rich work history represents several notable careers in Boston over 30 years as an elementary school teacher, nonprofit executive manager, university lecturer, and 10-year cabinet official under the late Mayor Thomas M. Menino. Again, Juanita left an indelible mark during her 10-year stay in DC as a nonprofit education manager, senior program manager with Fannie Mae's Office of Community and Charitable Giving, and project manager for outreach, Fannie Mae's Making Home Affordable team, engaged in expanding homeowner access to the Obama administration's Making Home Affordable programs. Upon retirement in October 2014, Juanita and her late husband actually moved to Charlotte, North Carolina. Ms. Wade has 3 adult children. Everybody, let's give Juanita a round of applause. All right, next we have Dr. Julian Montoro-Rodriguez. He's on the front, his lovely pink shirt. Dr. Montoro-Rodriguez is a sociologist with a teaching and research background in the area of aging, health, human development, and family studies. He is interested in testing theoretically based interventions designed to help family caregivers to reduce stress, depression, burden, and increase the quality of life of older adults and their families in North Carolina. His research examines the interrelations between formal and informal support systems and optimal adaptation to development changes among diverse older adults. Let's give Dr. Montoro-Rodriguez a round of applause. And last but certainly not least, the birthday girl. Today's her birthday. And she's spent it with us, which I think is is Miss Venitra Wade. In March 2012, Venitra Wade-Dean's life changed forever after receiving her mom's life-altering diagnosis. Her parents, Dr. Jerry Tyrone White and Frankie Mae Allen White, were married 52 years before her father passed away in December of 2010. Her mother was devastated and asked her and the family to move in. Shortly thereafter, she noticed slight changes in how her mother handled daily tasks. As months passed, she realized this was not due to her father's death. Something else was wrong. After several examinations, her family received that dreaded phone call. Her mother was diagnosed with early-stage Alzheimer's. She was blessed and thankful to support her mom in her journey for almost 9 years. In September 2020, her mother's journey with Alzheimer's came to an end and she passed away peacefully at home, surrounded by family and lots of love. The journey did not end with her mother's transition. It led to an ongoing celebration of her life and sparked her desire to become a caregiver for caregivers. Hence, the Frankie Mae Foundation was born. Although caregiving is rewarding, it is also very hard work and can take a toll on the caregiver. The foundation provides a safe space for caregivers to connect and be cared for holistically through monthly meetups, programs, education, community resources, games, laughter, and services to inform, inspire, and help improve the caregiver's quality of life. As Venitra always says, you can't pour from an empty cup. It is satisfying to her soul to provide caregivers in it as an outlet to fill their cups. So that is Ms. Venitra. Everybody give her a round. I told y'all this was so amazing, and I get the honor of facilitating this conversation tonight, so I'm playing double duty. And we're just gonna go ahead and get started with the first question, which is for everybody. Anybody can answer this. So how do you define caregiving in your own words, based on your own experiences? So anybody want to start?
How do I define caregiving? Like Venitra, I cared for my mom for the last 10 years of her life. Stand up. You can sit there. Is the mic?
Can y'all hear her? Or
Can
is this
you
mic
hear
louder?
me now? I guess you can hear me now. So, like Venitra, I cared for my mom as she struggled with Alzheimer's over a 20-year period. Alzheimer's for a very long time, and she was with my husband, my children, and me until she passed in 1999. It seems so far away, but it was really just yesterday. And so caregiving, how do I define it? I always tell folks that your responsibility is to create a comfortable, loving, safe space for your loved one as they go through this journey. And I really just use those 3 words. You've got to have the right environment, a safe environment, you have to have a loving environment, and a supportive environment. And if you provide those 3 strengths, those 3 virtues in your situation, you'll be pretty successful at caregiving. But it's hard work, and everyone who chooses to be a caregiver won't end up being a caregiver. We'll talk about that later.
And those attributes that you just talked about, I will add patience. You have to have patience to be an effective caregiver, and I know it sounds easy, and it will test your patience, but you just have to put yourselves in that other person's shoes and know that you're doing this out of love, you're doing it because that's what you want to do, so.
Yes. So for me, caregiving is another transition. We do many transitions over time. We become parents and professors, and caregiving is one of those difficult transitions for many people. People feel stressed, and the question is why? And because there is a conflict between the relationship, the family relationship. I am the daughter or the spouse, and I help my relative as I normally do when somebody needs help in the family. But lately I've been doing things that is more than that. I don't know what it is, I don't want to know because I fear the worst. So stress is sort of increasing, And if only when the person realizes that he's taking on the role of caregiver, then she start or he start to understand that there is a plan here that needs to be built. And my stress has to come down in order for me to help them. So you become a formal caregiver, informal caregiver most of the time, and you plan that accordingly. You have a plan of care, and you need to be aware of what kind of services and formal services you need as the progression of the disease or whatever condition happens there. So it's difficult, but accepting the role of the caregiver helps the family member to do a better job and to increase the quality of the relationship or the care of the person. It sounds like a professor, but I'm better. I think it's important. This is called an identity sort of crisis because you don't know who you are. I am a relative or I am a caregiver, and that changes my world.
That's great. That's great. And so my next question, I want to get into just some conversations around communities of color specifically when it comes to caregiving. Growing up, I can even speak from experience. Oftentimes we didn't count that as caregiving because my dad was taking care of my grandmother, or my aunts and uncles now are taking care of my grandfather. It was just that's what you did. That was just traditionally that's what you did. So when you're looking at communities of color and caregiving, what are some common misconceptions that you would say, Juanita, are associated with those kind of things?
Well, unfortunately, people really believe they can slip into the role. You know, it's mom, it's dad, it's my sister, it's auntie. And so this is something I could just slip into. And I would say, if you're talking about Alzheimer's, I'd say in the first phase, asymptomatic phase, that's probably okay thinking. You could slip into this because you're really partnering with your loved one as they meet the challenges along this journey. And so the patience that Venitra talked about is important, but you're sharing the role. You're taking on this responsibility. Understanding this journey will get more difficult as it goes along. So one of the misconceptions I would think is people think it's really easy. People think that they can do it by themselves. We're going to talk about that. A whole network and support system, because you can't do it by yourself. And I think the third is that I could change this person's mind. I can communicate them the same way that I communicate with other members of the family who do not necessarily have Alzheimer's or any other form of dementia. It is an absolute incorrect assumption because the communication between the caregiver and the person they're caring for will change over time. And oftentimes people are not ready for those changes. So I say those three areas are big misconceptions.
Would anybody else like to share maybe any kind of misconceptions?
Yeah. So we know that caregiving happens more with minorities and low-income families. And so we find more mental health issues among those communities. And we need to provide the adequate services to them. So just because the family is going to help, that's not the solution. You need still the service. And just because you think that you are responsible and nobody else can come into my house, you are going to feel bad because you cannot do everything, like Juanita was saying, especially when it comes to skilled care. And then you cannot have help from the outside because you don't allow that, because you have this duty to do yourself. And that is playing against you. So you need to diminish those negative emotions and feelings and focus on what you can do to improve the relation with the person you are caring.
I wanted to add about the mental health aspect. May is National Healthcare Month, and wanted to piggyback on that. In the Black community, I know we've gotten better with the stigma with mental health, but just wanted to reiterate that it is okay to have a therapist. It is okay to reach out, and I am a firm believer in prayer, but you need something else other than prayer to help you through the caregiving journey. So reach out, talk to a therapist, and there's nothing wrong with talking to family members and friends, but let your family members be family members. Let your friends be friends, and let that professional mental health therapist be a mental health therapist.
And I guess I'll piggyback on just the conversation that was starting to bubble up around caregiving kind of cross-generationally. So it's a term recently that I learned about through Sarah, our chief philanthropy officer, the sandwich generation. And a lot of people may not really understand what that is. I feel like there's a lot of practitioners, there's people in the room that have close proximity to caregiving, but for the folks that are streaming with us, or maybe folks that are here who may not know, but according to the Pew Research Foundation, the sandwich generation refers to those caring for aging parents, but also caring for their own children. But then you'll even find the club sandwich generation. I don't know if you heard about that, but it extends beyond just maybe your parents and maybe your sons or daughters, but extended family, a godson, a niece, a cousin, a great aunt, or even your son's college roommate who's couch surfing and needs support. Ultimately, you're taking care of this person. They're staying in your space as well. So my question for Venitra is, how do you believe caregivers of color are impacted mentally and emotionally if they're serving multiple generations, as opposed to maybe, okay, I'm just caring for maybe, my parents and my kids have all gone on and stuff like that. So what do you think that effect is like, or that impact is?
So I can speak personally on that. My daughter was 5 when my mother was diagnosed. My daughter was 15 when my mother passed away. So you think about my daughter just starting elementary school and then middle school, and her first year of high school was COVID. And so we were dealing with a whole lot during my daughter's, those like years caring for my mother. So I'm caring for my mother. I'm navigating this 5-year-old, this 12-year-old, this 15-year-old hormonal teenage girl, and dealing with caring for my mother, and I'm married. So, trying to navigate, juggling being a wife, being a mother, being a caregiver, and then trying to find time for myself. And, there were days, and my sister is here, and my niece is here, and there were days I was literally in tears and would call my sister, would call my brother, and was like, I need help. Can somebody come over here? So, just being in that sandwich generation and just trying to juggle everything and trying to balance and trying to figure out what my limitations were and when I needed to tap in and let somebody else take charge, and realize that, like you said, you can't do it all. And it was definitely an experience being part of that sandwich generation.
I can only imagine kind of what that looks like in real time, because that is a lot. And I do want to say too, I forgot to say this, if you have questions, there are cards that were gifted to you all. My brain moves so quickly, and not quick enough with my mouth. But there are cards on the table that you receive. If you want to write down a question on the card, Maddie and Sarah can grab those cards for you and put them in a bowl, and we'll have a little Q&A at the end of the session. We'll answer some of your questions, some of the questions that were online that were given during our registration process too. So jot those questions down. Thank you, Venitra. Would you like to add anything?
Yes, I do.
Okay.
I just want to stress the point that those who are caring for parents and children and working, how can you help them? So I think that we have to have flexibility in the job place, and we have to train businesses about what is being a caregiver and how flexibility not only will benefit the caregiver but also the business, bottom line. And there are actually initiatives in the city, like the Dementia Friendly Initiative, and Ashley is part of that. And they try to educate and train businesses and other sort of places where you can go with your relative. Lately, like if you go to the airport, how do you deal with a person with early dementia in the middle of the airport, which is loud and so on and so forth. So the airport is willing probably to actually have an environment where they can actually have a better kind of experience. But that flexibility on the part of the family or the part of the business is essential in my view.
I want to have Jamila move on to the next question, but I just want to make the point that the blended situation where young people and older people are living in the household together is so common for folks of color. It's very common. I ask the question, how many people in the room whose family is raising someone other than their biological child? Okay. Well, what's important in their household, if someone's very little, very young, is to engage them in the process of caregiving. Don't have the young children and the teenagers sit off or hidden, or when grandma's there and grandma needs support, kids are taken away. You'd be surprised when I do training with folks that that's common. That is common. And we have to understand that caring for our loved ones is a family affair. Even if everybody in the family doesn't know they're supposed to be involved. That's a whole other conversation. It's a family affair. And so young children should understand what the loved one is going through and the difficulty in communication. Those teenagers should understand that, and older adults in the household, because they're part of the support system. They are part of the support system. When you hide them and move them away, what's the message you're sending to the older adults who may have Alzheimer's, or may have cancer, or may have some other life-threatening disease, and you're hiding the kids and not talking about it? So it's a family affair, and engage everyone who can be engaged.
That's good. Thanks, y'all. Thank you. So my next question. According to Mental Health America, Black and Latinx caregivers often feel ignored in medical settings and left out of crucial care discussions by staff. Asian American caregivers do not utilize professional support services as often as others, likely because of limited culturally relevant services. Dr. Rodriguez, can you speak more about this data and racism in our healthcare system's impact on caregivers as well as those being cared for? That's a heavy one.
We do have many sort of barriers or obstacles to actually use care. In minorities, of course, more. But I think about this, just age is a factor for risk. As you get older, you become invisible in many ways. So in addition to that, you have to bring all these cultural aspects and structural problems that we have. And so minorities have really a tough job to do there. And so how do we motivate them to use the services and to be part of the network of support? So normally what we will say, we have the personal characteristics of the individual and their own culture that can impact the use of services. We also have the structural problems with lack of income and support services and support resources. And we also have the medical problems. So normally you need a service is because you need it, not because you are from this group or that group, or not because you have more friends than other person. It has to be because you need it. Anytime you need it, you should qualify to get the service. You don't need to be 65 in other words.
Thank you. Would anybody else want to add to that?
Currently, our health system doesn't work well for people of color, and we know that. Whether it's infant mortality, whether it's the array of poor health indices that particularly African American families have, we are oftentimes not heard when we go into the doctor's office. Either the nurse practitioner or another staff person, a health tech, is taking down notes before the doctor comes in. Sometimes those notes are accurate in terms of what was said, sometimes those notes are not. But what often happens for, particularly again, Alzheimer's or dementia, people, the medical team is not listening, not paying attention to what the person's saying. They may have difficulty with English language, they may have difficulty with the Queen's language. But not being heard means late diagnoses, not being heard means painful health situations, not being heard means you're not getting the care. And so the array of needs we have are significant in terms of increasing culturally competent staff in clinics and hospitals. That is basic. Making sure that when you go to the clinic, write stuff down so that you won't forget that you were supposed to bring it up. And if in your communications with the health team, they're not responding, repeat it again. Repeat it louder. And if they're still not responding, ask for someone else. Change doctors. The support group that I work with, we say all the time, if this doctor's not working for you, you've got to find somebody else. But the bottom line is that in the health industry, we are not the top of the agenda, we're not the priority, and we have to struggle for every movement that is made in terms of quality health care.
Go ahead, Doc.
She's so right. I mean, you go with your loved one to see the neurologist, and you cannot go into the office for the examination. They don't talk to you. You don't count. How can that be? Because the caregiver and the care receiver is just one. It's not just two people. So we need to tell these health systems incorporate the caregiver into the decision-making process and provide services for both, not just for one. That would be one thing. The other thing I wanted to alert is that it's not that we need all services all the time. At the beginning, probably we need more information, and then when we provide care for a long time, we start to think we need respite. We need to take time out. I need to take care of myself. And where are those services in our community? I need to look at my former student Ashley again, because she's the director of the program care that provides respite, but not for everybody, because we don't have enough resources. So that has to stop. That has to really be part of the plan to support caregivers, especially minority.
For sure. Thank you for dropping those tips too, because I think oftentimes when you are in those spaces, you may not feel empowered enough to say anything, especially as a caregivers of color. It's nice to hear you all say those things right here, especially for the folks in the room who are interfacing and supporting loved ones at this moment. Yes, definitely research another practitioner, ask the hard questions, and move on and find those great support groups that can really help in navigating this journey that you're having caregiving with folks. So thank y'all. Another question. According to the American Psychological Association, collectivism is a social and cultural tradition, ideology, or personal outlook that emphasizes the unity of the group or community rather than each person's individuality. Most Asian, African, and South American societies tend to put more value on collectivism than do Western societies, insofar as they stress cooperation, communalism, constructive interdependence, and conformity to cultural roles and mores. How important is it to understand the collectivist nature of many BIPOC communities when it comes to caregiving? And that's for anybody who feels led.
And so when I hear collectivism, I think of village. It takes a village. And as we've all talked about, you can't do it alone. You have to have a support system. I don't care how much of a superwoman or superman you think you are, you need help. Caregiving will test you to your limits. And so support groups, your girlfriends, your guy friends, your church, your co-workers, reach out and don't be afraid to ask people for help. And when people offer help, take it. You know, a lot of times we're proud and we don't want people to think we need help. Don't be too proud to take that help when people offer it. And don't be afraid to ask for help. Like I mentioned earlier, I would call my sister, I would call my brother. I had girlfriends that I would call, hey, I just need an hour to myself. So don't be afraid to ask. Don't be afraid to be specific in your ask, because a lot of times people don't know what you need. So you have to be specific in what you ask for. Hey, can you come over for an hour? Hey, can you come and do laundry? Do you mind having food delivered? I don't feel like cooking. So be specific when you ask for that village to step in and help you when you need help.
I just want to ask that you expand that village beyond your family, your church, and some of the close circles, and expand it into your neighborhood. You know, Alzheimer's Association has a video that I really love, and it's a woman talking about her husband who has Alzheimer's. It's 1 o'clock in the morning, and it's cold and snowy outside. And he and she are having a conversation, and then he says, well, I have to leave now. I have to go and see my wife. And so she says, okay. And so he gets up, doesn't put a coat on or anything. And his slip is, he walks down the street in the snow and knocks on a door about 5 houses down. And the wife looks out and she sees the door opens, and he goes inside, and after about 10 minutes, she puts on her coat and walks down there. Now, the neighbor is a good friend and knows that her husband has Alzheimer's. So when he knocks on the door, she lets him in and waits for the wife. Just imagine if at 1 o'clock in the morning, and some man knocks on woman's door and demands to come in because he's her husband. How do you think that would end if the neighbor doesn't know who this man is, or that he has a form of dementia? So let's not assume folks know what's going on in your house. Take the opportunity to educate your community about who's living in your home and the kind of care and support you need. And you let the local grocery store know, or bodega. You let the local fire department know, and you let the local police department know who's living in your house and what they can expect if they knock on your door.
Yeah, and I will say, we registered with we live in Huntersville. We registered with the Huntersville Police Department. We had all of our names, our ages. We even had the dog listed, and we had a guinea pig at the time. So they will know who all is in the house. And we had to call paramedics several times for my mother when she fell and some other instances. So when they came to the house, they already knew my mother has Alzheimer's. This is what is going on in the house. So yeah, please make sure you register with whatever city you're in, with the fire department, the police department, so they know who's in that house and what the situation is.
That's super important, especially when we have discussions around Black and brown folks being gunned down for situations. And it's because of people just not being aware of kind of what they have going on, what they're dealing with. So I appreciate that response. Were you gonna say something?
Yeah.
Go ahead.
I just want to say that everybody loves to have the family supporting, and this informal support for the caregiver is very important. But also, if you live in a place where there are no formal services in the community to support you, You may move to another city. And, you know, that indicates that we need to have the two systems of support, the formal services and also the support of the family as much as you can, of course. Family is not that idea that the family help each other. Every group that I know appreciates the support from the family. That's a given. The problem is when that's the only thing that you have. That's a problem.
Yeah, and I want to ask a question kind of related to this, and I know that I feel like Venitra and I and Juanita and I have had conversations around this too, kind of some taboo around putting mama or daddy in a home or receiving certain services in the Black and brown community too. So though the collectivist, the idea of collectivism, like we work together, we move together, we support each other, but what happens when we take that notion so deeply that it's almost detrimental to our mental health? When do we step in and say, okay, I need to look into some kind of care service? So I would love to kind of get you all's perspective on that, because we do not put Big Mama in the home. We just don't do that. That's not what we do. So why? Like, I want to kind of have a comment around it.
Well, some families do put Big Mama in the home, and need to. You know, about 70% of people who are living with the disease of Alzheimer's live in our communities, not in care facilities. They're living upstairs from you, next door, the farm that's about a mile down. That's where they're living, which means we pass them every day. We see them going for their meal, we see them in the grocery store, and so forth. So about 30% of folks living with disease do live in care facilities. And again, care facilities are so important, but need your engagement. You know, from the support group that Ashley and I facilitate, people talk all the time about the difficulties that they have. Information is not shared with them, the expectations of the care facilities. And I am not talking against care facilities. They are essential for families, absolutely. But stay engaged, do your homework, make sure you are checking out the best place for your loved one, not the best place for somebody else's loved one, for yours. And do what you can to stay involved with the administration. And again, like we said about doctors, if that care facility is not working for you, you gotta leave. You gotta find another one. Take the time to find another one. And always, I would say, make sure your visits aren't scheduled at 2 o'clock every Wednesday. You have to go at odd times, late, early, whatever, and talk to the staff so the staff knows you when they see you.
So, you know, like you said, facilities are essential. And I tell our caregivers, you do what works for you. We made the decision as a family to let my mother age in place. And we were able to do that because we worked together. My husband's schedule, my schedule, my brother and sister, and then my mother had a long-term care policy. And so we were able to pay for someone to come to the home during the week to help out, and it worked for us. That doesn't work for everybody. So you have to do what works for you and your family. If it's a safety issue, if it's a physical issue, if it's an emotional issue, you have to do what works for you and your family. We did what worked for us, and it worked very well.
I just want to talk a little bit about COVID-19 and what happens to all the caregivers in the community. The level of not just stress, but also isolation, for instance. And it was very difficult for everybody. And some of my colleagues and myself put together this program to support caregivers in the community. But the program was offered face-to-face. So we put it all online through Zoom. And we train facilitators in our organization here in Charlotte. And we have 200 people who sign up for the program, a program that provides information about how to reduce stress and depression, that helps them to communicate with others much better, that also helps them to connect with other caregivers. And we also give them skills to ask for help and seek help from others. And it was a total success in the sense that the data, when we finished the 2 years of offering the program, demonstrated that it was a very efficient in terms of reducing stress, improving positive aspects of caring for somebody else. And so those programs, which are we call psychoeducational programs, are very needed for caregivers. And I propose to you, I propose to the health systems that the same thing that they have treatments based on pills, they have treatments for behavioral programs where caregivers can actually get confidence on how to provide better care to the loved ones.
Thank you for sharing. Thank you. I love the fact that you all spoke about doing what works best for you as opposed to kind of what historically has been done, culturally has been done. You know, like I said, not put Big Mama in a home, but you're like, look, I have to look out for what's best for my family, what's best for my journey with caregiving. And if that means, you know, or not purchasing, but hiring other folks to help support, then that's perfectly fine. A lot of you all have already talked about like self-care and like creating a community, so I'm not gonna hit on those questions because I don't know what our time is looking like. I have a timekeeper in the back. I don't know what 2 means. Okay, that does make sense. Yes, so I'm gonna ask one last question to them, and then we'll have some Q&A. And like we said before, if you have questions, write them down on the card and make sure you give them to Maddie or Sarah, or Elsa's been walking around too. But we're going to the last question. The Kapuna Caregivers Act was signed into law in 2018. This law, instituted in Hawaii, was initiated to support those working full-time and serving as the primary caregiver for aging parents. Through the program, caregivers receive a stipend and other supportive services. Unfortunately, the program dissolved due to funding. Now, with growing concerns around support for caregivers in states like Hawaii, at one point instituting laws like the Kapuna Act or Caregivers Act, are there any other current policies associated with ensuring that caregivers are provided with what they need? If so, could you give us some context or give us some information about those specific advocacy agenda items? Especially because it's voting season, y'all. It's that time, so.
So, in the study that we had 40% of African Americans and 60% of whites. The difficulty we have is that they were middle class. They weren't really the low income caregivers that we were looking for. Because during COVID, it was very difficult to reach out to caregivers in low-income communities. And even worse, we didn't have any Latinos or any other person from any other minority. And so my team is now translating the program into Spanish for the Latino community and adapting the program for the Latino culture. And we hope to do this during this year. By the end of the year, we will be able to run a demonstration trial to see if the program works. But do you know how many caregiver programs, behavioral programs are for Latinos? Pretty much 0 or 1 or half. And so, talking about minorities and the need to support the caregivers, it's very different for every group, but we go to the same place. We need those programs and those services. We were very lucky because Southwestern Retirement Community sponsored us in this research, a lot of money, and I'm very happy and very grateful to them because we hope that the program is going to help many caregivers in the community.
And I know, Dr. Montoro mentioned Ashley with Project Care, and then also Central Lina has funding for caregivers. And so we try to let our caregivers know about those financial resources that are available for them, and not just the financial resources, but I mentioned about the mental health piece. We provide our caregivers with free mental health therapy sessions. We've partnered with another nonprofit to have groceries delivered for our caregivers. So the caregivers and anyone in the house can get free groceries up to 12 times per year. So we try to make sure that our caregivers know that there are resources, not just financial resources that are out there for them, but other resources that help with the day-to-day life of being a caregiver.
And I would only add that definitely take advantages of both the resources that Julian and Venitra have spoken about, but we also recognize that there aren't enough. There's huge gaps in what's available for families who are struggling to provide the best care for their loved one. For example, someone who gets early onset Alzheimer's may have to stop working at 45 years old. And if that's the only income coming into that household, you know, Social Security does not allow that person to collect early. Why not? Why not? So where there are opportunities for us to change policies, we have to step up. Legal women's voters over there. We need to step up and think about what are the policies we need to put in place that will benefit families who are taking on this huge responsibility for the loved one who's going through a difficult journey. Know that there's not enough resources, there are not enough programs. In the support group, we talk very often about how can I get respite? Where can my dad go that's comfortable, that's fun for him, that's safe for him, and that I can get some rest? Or where does my mom go? Because I have to work all day, and who's going to be there with her? So the questions and the needs and the services that families demand are not there. So we need to take our time to work with our legislators to make sure that the issues about long-term care for adults, we've done a lot of work around child care, but we need to focus on long-term care for adults. Nothing is too big for us to ask for, so go big.
I agree. And I've never heard of an adult daycare until my mother was diagnosed in 2012. So we took advantage of an adult daycare. And when I tell you that was life-changing, as much as I love my mother, we could not stay in that house together all day, every day. I was working from home before COVID, and the adult daycare was really a lifesaver for us. And you know, I let our caregivers know about the adult daycares in Mecklenburg County, and you know, just let them know, don't wait until you're ready to strangle mama before you start that process of looking into an adult daycare. It's not for that emergency situation when you're at your wit's end. It takes time. Like you said, there's a waiting list for adult daycare. So I let the caregivers know, start that process early so you can take advantage of those resources.
That's good. Y'all said a ton of great stuff, and I definitely want to highlight the voting piece. I was literally texting my friends earlier today, and I was like, you know, our taxes, we pay for these people in office, like we're paying them. So it's imperative that we make them work for the money that we provide them. So ask the big questions, reach out to legislators and people in government about the policies and issues that you may be interested in and feel like they need to be advocated for. Because ultimately, we want those folks in office that can definitely support our own, our personal needs, right? All right, so can we just give them a round of applause real quick? Just one question, but I appreciate y'all perspective and everything. And we had a couple of questions from the audience that I'm gonna go through. Okay. So, what's next when something happens to the primary I heard it. the primary only caregiver and there's no one else to step in. So like what happens if that caregiver is unable to be a caregiver anymore?
You know, we're at a time, I think, in this country that's quite different than just 30, 40 years ago. You know, young people grew up in a town and stayed in the town. Now, young people grow up in a town and may go to a university in that town or not, but often by the time they're 20, 25, they're moving on. And they're all sorts of places around the country. And so we talk to the caregivers all the time and said, you know, I'm the only one here. The rest of my family is in, you know, Seattle or, you know, Los Angeles, and I'm here in North Carolina. What am I supposed to do? Well, the challenge is that we, again, how do you build community? How do you build community wherever you are? And how do you tap into family who can support you even from afar? Because being supported from afar may be dollars. You know, it may be support for you to get rescued, maybe some money for your loved one to go into an adult care facility during the day. But because people are not close by, this is an issue that comes up all the time about how do I take on this responsibility when I'm by myself? And we have to look at not being by ourselves. We need to look at our closest friends, our faraway friends, our old boyfriends, whomever, who is an important part of your life, who will step up when they're needed. Because the distance thing is significant. The other is you must, just as you do with a will, or you're putting together a trust for your family, you always have to have a second. You got to have a backup plan. So if you are the primary caregiver, you need to spend some time finding who's gonna be second, who's gonna be your backup. And it's not just your backup if you know, you can't cook for the night. We're talking about serious backup. If you are hospitalized, but the one you're caring for is at home, you've got to have a backup plan. I do not sit here and tell you this is easy, or that finding someone to pop in is going to be that easy. But you have to spend time with your family, even those who are far away, talking about a long-term plan for both you as the caregiver and for the person that you're caring for. Again, don't not ask because it's too big. You gotta ask, because all they can say is no, and then you go to someone else. But if you don't ask, you don't even get that.
Thank you. I'm gonna have to move on to the next question so we can bounce around with this. Let me see. Okay, so somebody's asking about being recognized as a caregiver. So what is that process like, let's say, for work, like, or for maybe when you are in medical facilities, do you let your provider know? Do you let anybody specifically know that I am now responsible for this person and, you know, I'll be assisting with any kind of decision making associated with it? Is there a process associated with that? Or is it just something you just hop into and you continue to kind of show up to appointments or anything like that?
Well, speaking personally, I'm not sure what the legal is, but my parents have been going to the same primary care physician for decades. And even before my mother was diagnosed, I would go to appointments with her. So her doctor knew that I was going to be at every appointment. My brother and sister, as the disease progressed, my brother and sister would even go to appointments with us. We built that relationship with my mother's primary care and with her neurologist. And so it was a given that we were going to be at the appointment and we were going to ask questions. And I was in that portal so much, sending messages to her primary care, and he knew the relationship. As far as any legal paperwork, I'm going to be perfectly transparent. I'm not sure because we didn't have to go that route.
There is a legal route. We don't all know it, but power of attorney clarity is a role you can take on, and if that doesn't work on that level, you can in fact take on the responsibility that you go to court and have the courts determine that the person is no longer capable of making decisions and you're in that role. But I agree with Venitra. Stop going to the doctor with your loved one. Never let them go by themselves. And you should be writing down what you want to talk about. Because I assure you, the person who's going for their health won't remember to necessarily take a note with them of what they want to remember. So take a note. Take a note of the behavior you're seeing, the frequency of those behaviors, and the intensity of those behaviors is what the medical team needs to know. So get information on what your legal responsibilities are. They're very important. Talk to an elder care lawyer. Not all lawyers know elder law. So be specific about the lawyers you get, but do your homework so that the medical team will talk with you because they know they have a responsibility to talk with you, as opposed to, well, HIPAA law tells us we can't talk to you, so we're not. Well, you need the information, so do whatever you have to do the legal side to get the information.
Yeah, thank you. The next question was about respite care, and folks wanted to know kind of like what did that look like for anybody here on the panel who may, have decided to go with respite care for their loved one. And what was that time like for you all to have that self-care, that reflective kind of moment? What did that look like to you all? And what did you do during that time?
So respite looks different for everybody. It can be a weekend, it can be a week, it could be a month, it could be whatever you want it to be. I know there were times we would do a long weekend and my brother and sister would hop in, or we would pay someone to come in, and towards the end when hospice stepped in, we would use hospice as well as the long-term care policy and have someone to come in. And I remember we went to Mexico for a week, and everybody else in the family, my brother, my sister, and my nieces and nephews are older, so they were able to help. And so the very first night, my brother had mama duty. He didn't last 12 hours. He texted me and was like, I don't know how you do this all day, every day. So from then on, they knew what we were dealing with every single day. And sometimes that's what it takes for people to understand what you're going through. They have to come and walk in your shoes to see what you're doing day in and day out before it clicks. Hey, I need a break. So that respite can look like a weekend away. It can look like a 24-hour away. And we had someone to come every other Saturday for 8 hours. And when I tell you, my husband and I were leaving skid marks, leaving out that driveway for 8 hours, 8 hours to a caregiver felt like a week for us. So take advantage of respite, and again, that's where you can utilize that community that, you may not have to pay for it. They might just want to come in just because they want to come in. So ask and see what happens, but you have to take time for yourself. And I know it's hard, but you have to make sure you carve out time for yourself. And I know yesterday at lunch we were talking, even though I'm not caregiving for my mom now, I still practice self-care. Once a month, I make sure I go see my massage therapist. It's written in law on my calendar that I still take care of myself. Day to day, just, not just caregiving, but just a human being, period. You have to take care of yourself. So please make sure you put yourself first and make sure you're taking care of yourself.
That's good. That's really good. And I'll let this be probably the last question, I think. Yeah. So somebody wanted to kind of discuss some of the assisted living facilities. There's a lot of conversation around it, but we see oftentimes that the majority of folks, or they want to kind of confirm, the majority of the residents there, are they normally white? And is that true? If so, why is that the case? And what are some societal implications of this disparity? That's good.
It's a social Well, that has to do with the level of socioeconomic status, because not everybody can afford $10, $15, or $20,000 a month. And so the question I want to ask her is, what happens when the caregiver is alone? Because there are a couple of options, and you have to have a plan, like they say, and make sure that something is in place. If that is not the case, what is going to happen is neglect and abuse. And I'm talking about, psychological abuse, physical abuse, financial abuse, you name it. We have a lot of that going on. People don't want to talk about that, but it happens in the community. It happens also in the nursing homes. So you have to plan, because that's a possibility, a very bad possibility that can happen to you. And you cannot just improvise. Let me give you an example. Many of you will remember this, what I want to say, because you are parents. When you have children, you don't know the other people, the other families, but you have this day a week. On Wednesday, we go to the park with the kids, and the moms go there not to see the kids. They go there to talk to the other moms, to say, if I cannot do this next week, would you take my child to go over here? That's a plan. So we need to do the same for caregivers. We need to connect them with other caregivers and other resources and organizations, so they can plan this sort of activities. That's what it works.
So thank y'all so much. And so I'm going to ask that y'all give them a round of applause. And if you all have any, we couldn't get through all of the questions, but if y'all have any additional questions, of course, if y'all want to reach out to me via email, I'll be sure to connect with these lovely folks, or even if they feel comfortable sharing their information, so you can check in with them. Let me get back to the podium. I'm going to switch hats. Because we have some thank yous before we wrap everything up. So again, I want to give some special thank yous and shout outs. Number one to just everybody for attending today. So give yourselves a round of applause. We truly appreciate y'all for being here. This is a very important thing we do, not a thing, something we do every year called Until Justice Just Is. And during that month, we highlight specific topics and areas associated with racial justice and advocacy. And this year, it was important for us to focus on caregiving. It's a topic that I don't think we've really discussed historically with YWCA Central Carolinas. So I love the fact that we're starting to have this conversation now, and we're able to bring forth information for people in our community, and get folks connected with amazing folks like the people on our panel, who do amazing work and have support groups, or who are doing research in the area. So, take this information and run with it. I would love to give a shout out to Sub One Hoagie. Sub One Hoagie is a Black-owned hoagie shop in Charlotte, and that's what y'all are eating today. An amazing father-son family company. Give them a round of applause. I'll let you on the screen or not, but definitely want to shout them out. Again, the philanthropy team. I feel like I cannot thank the philanthropy team at YWCA Central Carolinas. Kirsten's here, our CEO, enough for their support and letting me kind of be creative in my endeavors when it comes to what I bring. So I appreciate you all giving me the space to do that. And yes, that is all. Actually, we had an announcement. Kim, yes. Kirsten said you had an announcement. So come on up here.
Thank you so much. My name is Kim Motley, and I also have walked in your shoes. I cared for my mom and dad before they died, and I lived next door to my grandmother, and I was inspired to create a nonprofit honoring seniors and caregivers. And one of the new programming things that we're offering is a caregiver team. So we have one coming up on May 15th, and I would love to share that with you guys and list all of your organizations as resources, and also invite all of you. It's at the Pauline Tea Bar And if you know it, it's a serene, wonderful setting. So you can, yes, come, you know, bring a friend and just sit and have that community and resources and some wonderful tea. Thank you. Yeah, it's May 15th, and I forgot to mention, I brought a little QR code for our Eventbrite. So just see me and you can take a picture or scan it with your camera. We'd love to see you. Thank you so much.
Thank you. And we'll be sure to share these lovely folks' information as well, their support groups. I want to make sure Frankie Maywood Foundation, we shout them out and have their information on there as well. So thank y'all so much again. If we have food, like please take some food home, take a sandwich home, you can eat it for lunch tomorrow. So we would appreciate that. Thank y'all so much again and have a great night.